Hello everyone, this is Dr. Richa Mariam Roy, second year resident from Dr. Deepak Patkar Medical College, Pimpri, Pune. I'll be presenting my paper on MRI-based volumetric evaluation of the hippocampal region in pediatric partial seizure patients without signal abnormalities. I'll be doing this under the guidance of Dr. Purnachandra Lamgare sir. The study is partially based on a previous study, volumetric assessment of the hippocampus in structural MRI. There are no conflicts of interest. There was no financial support and sponsorship associated with the study. The only aim of the study is to determine the volume of the hippocampal lobe and its diagnostic significance in patients with clinical history, but having no abnormal signaling intensity on MR images. This study is done in concordance with asymptomatic controls who are having normal hippocampal volume. Coming to the anatomy of the hippocampus on MRI, hippocampus comprises of head, body, and tail. The hippocampus complex is located in the medial aspect of the temporal lobe, posterior to the amygdala. On MRI, hippocampal head is seen in the same coronal plane as the interpeduncular cistern. The body of the hippocampus is seen at the level of the midbrain, lies inferior to the choroid fissure, and is separated from the parahippocampal gyrus by the hippocampal fissure. The tail of the hippocampus is located at or behind the midbrain, where it is seen adjacent to the crura of the fornicis. Hippocampus plays an important role in the secondary memory, and its volume is significantly affected in patients presenting with seizures, especially in pediatric age group. Volumetry of the whole hippocampus is often regarded as the best method for quantifying MR detectable pathologies in the hippocampus. Volumetric analysis is more important in conditions where only the size of the hippocampus has decreased but there is no abnormal signal intensity. In MR images obtained from 3 Tesla scanners, it is more possible to segment the hippocampus. It is a retrospective study. 30 children in the age group of 5 to 15 years were selected. Hippocampal volume measured by 3 Tesla MR scanner. The duration of the study was from January 2024 to March 2025. Our segmentation protocol uses the hippocampal uncal fissure as the medial border, which means that only the part of the subiculum contiguous with the hippocampus is included. The segmentation consists of two parts: internal landmark setting done by point-wise cross-setting in the sagittal view of the reformatted coronal image, segmentation of the hippocampus in the coronal series done by continuous pen drawing and point-wise sampling. Of the total 30 children in the age group of 5 to 15 years included in the study, 15 children with the clinical history of partial seizures but not showing any abnormal signal intensity on MR images are considered as subjects for the study. The rest of the 15 are asymptomatic children who are considered as controls for the study for determining the normal volumetric range. Informed consent was obtained from the respective parents and guardians of the participating children. The subjects are scanned in the 3 Tesla MR scanner and serial MRI of brain and temporal lobe was performed. Oblique coronal sections perpendicular to the axis of the temporal lobe were done with 2.5 mm slice thickness. T1, T2, FLAIR and FSPGR sequences were done. Hippocampal volumes are derived by manual quantification using volume share algorithms. Coming to the methods, hippocampal segmentation was done on coronal slices and scanned perpendicular to the hippocampal principal axis. The following scan parameters were used. The segmentation of the hippocampus starts in the body, which is easier part, and ends in the more difficult head and tail. Starting in the first slice of the body, posterior to the hippocampal head of the segmentation process, proceed to the last slice of the tail. Then the segmentation continues with the glance of the starting slice in the body from the first slice of the hippocampal head to the most anterior slice. The landmark set in the reformatted sagittal slice of the hippocampal region. The yellow line in the A1 shows the position of the coronal slice in the A1. The red crosses are used for the anterior and posterior limits and the green crosses are used for the other limits. The green landmarks transformed into the coronal view in guide of the segmentation, the red line, and in the anterior hippocampal head. After segmenting the whole hippocampus, it is 3D visualized to check for the deviation from the curvature expectations. Hippocampus should have a smooth curvature on the lateral side at the border between the hippocampus and the lateral ventricle. On the inferior side, the border between the hippocampus and the white matter of the parahippocampal gyrus should also be smooth. Discontinuities from the expectations regarding the curvature could be a result of patient movement that results in the every second slice displacement, and the radar must be open to this possibility. Unexpected discontinuities in the curvature that most probably are the results of such obvious errors can then be adjusted for the segmentations. Using the external landmarks, the full volumes were cropped in order to allow the better comparison with the earlier volumes found using external landmarks. The correlation between the cropped volume and the old volume were 0.87 from right hippocampus and 0.91 from the left. The correlation of the remaining anterior or the posterior volume of the whole hippocampus with each other and with the old volumes were, however, all weakly negative. The number of the hippocampal slices anterior to the anterior landmark and the number of slices posterior to the posterior landmark were also negatively correlated to each other. So this was the result that obtained after performing the sequences on all 15 cases and controls. Coming to the results, in the study, the normal range of the hippocampal volume is determined to be 2.6 plus or minus 0.35 centimeter cube on right side and 2.5 plus or minus 0.35 centimeter cube on left side. Of the 15 children with positive clinical history, 12% of the patients have shown mean of the right hippocampal volume as 2.0 plus or minus 0.35 cc and of the left hippocampal volume 2.1 plus or minus 0.35 cc, which is decreased compared to the control population. Coming to the conclusion, volumetric analysis has found to be more sensitive with the detection of the volume loss in patients with no abnormal signal intensity. In concordance with the visual inspection, the volumetric range helps in the accurate diagnosis of various conditions like mesial temporal lobe epilepsy, schizophrenia, Fragile X syndrome, and post-traumatic stress disorder.